Hi, my name is Lauren Treat, and I'm a child neurologist as well as a pediatric palliative medicine physician at Children's Hospital Colorado. In my practice, I combine these two fields to help families and care teams talk about quality of life for children and families, especially those with diseases of the nervous system, like seizures, developmental delay, genetic conditions, and brain injury. My goal in this video is to clear up some of the misconceptions about palliative care, as well as to give you some tools for helping support families who are making medical decisions, especially as it relates to children with neurological impairment. These tools can be helpful from the provider side, knowing how to frame the news that you might be delivering, as well as from the family side, giving parents more language to use to advocate for themselves and their children. I'd like to start by explaining a little about palliative care. Palliative care is a medical specialty that helps people with serious illness live as well as possible for as long as possible, understanding that both the quality and the quantity of life need to be considered. It's not hospice. Many people misunderstand that. Hospice is about end-of-life care, whereas palliative care is more of a broad umbrella about the entire journey, and it can be accessed at any point along an individual's journey to provide an extra layer of support. The field of medicine is more advanced than ever before, which is great news for patients and families since we can diagnose and treat more and more conditions thanks to cutting-edge science and continuous improvement. At the same time, we're making our patients' and families' lives more complicated than they have ever been in history. We're asking parents to decide whether to take on the burden of new medical equipment in the home or whether to allow brain surgery that might help treat seizures, but potentially could be accompanied by other problems. Palliative care is not a magic wand. I can't take those realities away, but I can help families feel like they're taking back some of the control in their decision-making in an otherwise very chaotic situation. I tell families all the time that our work together is not aimed at trying to predict a roadmap for the future, whether they plan to turn left or right at a given fork in the road. Instead, my goal is to help people build tools for how they'll approach that decision when they see the fork in the road ahead. One of the main tools that's relevant for most decisions is to envision a counterbalance or a teeter-totter. On one hand is safety, all the things that keep people healthy and alive. And on the other side is comfort, things about being free from pain, being relaxed, and being in your preferred environment and having autonomy over what's happening. One of the unfortunate hardships when someone has a serious illness or a body that's fragile is that it becomes really hard to balance safety and comfort. We wish so much that these things could tie every single day. Both safety and comfort are good things, but in a crisis, safety is usually the thing that wins out for most people, and that can feel like a helpless place to be because it feels so automatic. And now, if we use this teeter-totter to illustrate this, but we can bring awareness to what's actually happening in that decision. And when we allow safety to be prioritized, the priority on comfort goes down a bit because they're linked. Take going to the hospital, for example. Being in the hospital is not as comfortable as being at home, even though we try really hard to help people be as comfortable as possible while they're here. That's largely because of the protocols in the hospital that are designated to promote safety. Nursing checks, diagnostic tests, treatments, all those things. Anytime we shift this balance in favor of one side or the other, we have to ask ourselves why we did that and what would make us change back the balance. And if someone really stops to think about why they allow this balance to shift, it's because of two things. It's because, number one, we think we're going to get something out of the sacrifice we're making. And number two, because we think that shift is going to be temporary. So if we go back to the hospital example, we go to the hospital because we believe the medical team can help us reverse a problem that we're having, and we think they'll be able to do that on a relatively short-term basis. Now, if either one of those two assumptions seems like it might not be true, that is, if the problem we're having seems less likely to be fixed, or if the timeline seems less long-term, we might need to reevaluate how much we let that safety and comfort equilibrium be out of balance. And just bringing awareness to these elements in the decision that seem so automatic can really help people feel empowered to navigate a stressful situation in a way that makes sense for them and allows them to express their own values about that balance of safety and comfort, what's tolerable and what's not tolerable. Especially for many neurologic diseases, there's a considerable amount of uncertainty about what the future is going to look like, what the symptom burden will be, what amount of disability someone might face, and what the child will experience down the road. As a child neurologist who's familiar with these conditions, my work as a palliative care physician allows me to provide this tailored support for patients and families who are feeling overwhelmed by the choices that they're facing, either now or in the future. My goal is to help families minimize regret about their medical decisions, as well as to help them feel less alone when they do face questions about the future. As medicine gets more and more complex, we really have to double down on these kinds of supports to make sure we're helping people live well, not just longer. So if you're a provider and you're working with a family who's wrestling with an upcoming decision, or if you're a family that would like some more support in navigating how to bring your own goals and values into the medical context, consider asking about a palliative care consult. And know that this kind of medical care can be available to you at any point on your journey to help your child live as well as possible for as long as possible. The palliative care team at Children's Hospital Colorado is called the REACH team, and you can find more information about it on our website.